It's a big privilege to be talking on COVID-19 infection. The question you want to ask is, what is COVID-19 infection? It's an infection of that part of your body which you use for breathing. It is caused by a virus called coronavirus. This virus used to infect animals such as bats and rats. But recently, starting from Wuhan, China in December 2019, the virus started affecting humans because humans are adventurous. This strain of coronavirus is a new one, and unlike the previous strain of 2002/2003. On the 31st of December 2019, the World Health Organization notified the world of this new disease that started in Wuhan, China. Then on the 7th of January 2020, the virus was identified as causing the COVID-19. The WHO called it a new strain of the virus, a new strain of that virus of severe acute respiratory syndrome, coronavirus 2. Nigeria had the first case of COVID-19 on 27th of February 2020, when a man traveled in from Wuhan, China. At the beginning, it became clear that travel history was important in causing the spread of the disease. But right now, we are at the level of community transmission of the disease. And what this means is that we do not need to travel before the infection can be acquired. Having contact with any person who is infected with COVID-19 around us is enough to get infected. The COVID-19 infection can be acquired through person-to-person contact, especially when a person coughs or sneezes or even talks. The disease can also be acquired by touching surfaces, for example, doorknobs, tables, staircases. And if the infected person coughs up or sneezes, small droplets of liquid that follow that cough may drop on surfaces. And when a healthy person touches the surface, it may get infected with COVID-19. There are some myths about COVID-19 infections. And there are a lot, but I'll just dwell on a few of these. Some persons say that COVID-19 infection is not real and does not exist in Nigeria. This is not correct, as we know that COVID-19 infection is real. It exists globally and also in our country, Nigeria. Some other persons say that COVID-19 is a disease of the rich persons. This too is not correct, as COVID-19 infection affects the rich and the poor. Thirdly, some persons say that COVID-19 infection is a disease of the elderly. This again is not true. COVID-19 infection is known to affect all age groups. Fourthly, some persons say that COVID-19 thrives only in cold weather. This infection is not only for the cold weather, as the infection can be transmitted in all areas, including areas with hot weather. Fifthly, some persons have the opinion that drinking warm water with lemon protects against COVID-19 infection. We know there's no scientific proof that this is effective in preventing the disease. And some people now think that eating garlic will prevent COVID-19 infection. There's again no scientific proof that eating garlic has protected persons from acquiring COVID-19 infection. There are also some persons who think that taking a hot bath is a way of preventing this new disease called COVID-19. Taking a hot bath will not prevent a person from being infected with this disease because the body temperature remains around 36.5 degrees centigrade to 37 degrees centigrade, regardless of the temperature of your bath or shower. So what are the symptoms of this condition? In other words, what are the complaints the person will come up with if he gets infected with COVID-19 infection? So the most common complaints that are being encountered include fever, dry cough, tiredness, and difficulty in breathing. The less common complaints include body aches, complaints of sore throat, passing of frequent stool, headaches, loss of taste or smell, body rash, and redness of the eyes, especially if this redness of the eyes is recent. The serious complaints will include difficulty with breathing, having chest pain, loss of speech, and loss of movement. So many of the infected persons really may come up with no symptoms. That's what we say symptomless. And a few may just have mild complaints. We do know that older persons and those with conditions like diabetes mellitus, asthma, or other disease of the chest, such as chronic obstructive airway disease, are more likely to have serious illness of the COVID-19 infection. So what is the incubation period? That is the period between when the patient contacts the infection to when it starts showing evidence of the disease. This is noted to be between 1 to 14 days, but on the average, 5 days. Are there ways of preventing this infection? Yes. Are there precautions we can take? Yes, there are. And the first on the list will be washing of hands. We will encourage us to wash our hands frequently. And this washing should last for at least 20 seconds. We should avoid touching our eyes, nose, mouth with unwashed hands. They ensure that we clean surfaces frequently. Such surfaces include doorknobs, phones, and tables. We should avoid handshakes. Rather, we should use alternatives like waves, the elbow, and the foot shake. In addition to these precautions I've mentioned, face masks should always be used when we are out of our homes. We should also learn to practice social distances wherever we are, in the church, in schools, and in the hospitals, even in the banks. And then lastly, there's need to have a balanced diet. Having a balanced diet is so important, particularly boosting your immunity. You will need a diet high in fruits and vegetables, moderate in carbohydrates, low in animal products, and also low in fat. So what are these fruits we should be desiring? They include pineapple, oranges, bananas, apples, and pawpaw. Therefore, vegetables, we are thinking of garden eggs, spinach, cucumber, carrots, and green peas. Are there carbohydrates we should look out for? Yes, they are brown rice, white rice, our native rice, wheat bread, and cassava. Then for protein, we should think of fish, eating more fish, chicken, turkey, goat meat, and snail. And then for fats, we should reduce the intake, but they include groundnuts and other nuts. In conclusion, I've presented coronavirus infection and preventable measures. I'm available to answer questions on this topic. Thank you for your time.
From afar, with fire in his eyes, he's standing by your door, he's waiting for you.